My name is Burley Rutland. I am presenting for the Eating Disorder Case Study Group, which included Kennedy Thomas, Lauren Alford, Mandy Jones, Susan Darawala, and myself. A little background on our case study. The subject of the case study was Joan. She was raised by loving parents in an upper middle class family. She had a younger brother who was killed at the age of 12 in a car accident. While in Joan's care, she was babysitting him. He ended up out in the street and being run over. Her parents became overprotective during her teenage years, mostly due to the loss of her brother. Joan married at age 19 and had a child at age 21. While the couple did try to save the marriage, including conceiving this child, they were divorced at age 25, and Joan ended up moving back in with her parents. Her eating disorder began when she became concerned with her weight after inactivity due to leg surgery. She began to restrict her food, and within a year, she was down to only 100 pounds. Although she was extremely thin, Joan still felt that she was overweight and continued to be very restrictive in her diet. Her life felt out of control, but she felt in control of her weight and her body and continued in this pattern for years. Joan's eating disorder escalated. She continued to diet and restrict her food. Her weight fluctuated from between 90 and 105 pounds. Her period stopped and liver problems began. Her skin and her hair also became unhealthy, and she frequently lacked energy. She engaged in binge eating and took laxatives to purge the food. She cycled between healthy eating, severe restricting, binging, and purging. Her weight fell to around 85 pounds as an all-time low after she had bowel system surgery that reconstructed her entire bowel system. Her treatment began with a 30-day inpatient stay in a psychiatric ward. Her diet was monitored, her meals were monitored, and someone observed her eat a 1,500 calorie per day food, which was more than she would eat in weeks and months at times during her active phase of her disorder. Her phone privileges, visitors, and outings were all contingent on her eating and maintaining this 1,500 calorie diet. Goals were set for calorie intake and weight gain, and she had daily individual therapy with a psychologist. After treatment, Joan returned to a supportive environment with her fiance and later second husband, Mitch. She maintained normal patterns of eating. She remained in therapy for 6 months and gained another 15 pounds. She learned to feel differently about herself and about food. Some case study questions. What special challenges does anorexia nervosa pose for family relationships? How does it affect patients in their roles as children, spouses, and parents? People with anorexia nervosa tend to experience childhood social discomfort, anxiety, and insecure attachment. And we definitely saw this in the case of Joan, especially after the loss of her brother and her perceived fault in his death. Her attachment with her parents became insecure and unhealthy. As adults, individuals with anorexia nervosa typically do not have secure attachments, and this was seen in Joan's first marriage with her attachment to her husband. As parents, they have difficulty reading interpersonal cues of their infants. This was seen to a degree with her relationship with her child. What does anorexia nervosa have in common with substance abuse disorders? People with anorexia nervosa relentlessly pursue starvation the way substance abusers pursue substances despite negative consequences. And this was definitely true in Joan's life. Her health was directly affected, her relationships with others, and her ability to maintain a job were all affected by her disorder, and yet she continued to pursue a starvation diet. Individuals with anorexia nervosa narrow their behaviors to a point where it interferes with other activities, such as work and family interactions, which is also found with substance abusers. Case question number 3. Much research has focused on the role of the media and standards of standards of beauty and the thin ideal in the etiology of anorexia nervosa. Do you think these factors are improving or worsening? Is there more or less pressure on adolescent girls and young adult women today to be thin? What about pressures for attractiveness on adolescent boys and young men? Being thin is generally considered the current cultural ideal, but recently a general body acceptance movement has challenged this idea. While that movement has challenged people's desire or ability or willingness to criticize people directly and in person, it hasn't slowed down people's anonymously commenting on people's pictures and pictures of others on social media. Arjona et al. 2024 notes that consuming and producing physically based social media pictures of others or posting personal images leads to greater risk of an eating disorder. So, not social media in general. Social media in general, the study was not able to prove a link between consuming generalized social media and an eating disorder, but specifically looking at other body images or posting body images of yourself and viewing the comments about those images is tied to increased risk of eating disorder. Body shaming is more subtle than in decades past, less likely and less socially acceptable to be verbally harassed directly about body image, but is more likely to read negative anonymous posts about individual body image or the posts of others about other body images, reinforcing this social ideal. So there's an implied, even if not direct, there's an implied idea through social media that thin is pretty, and if you're not thin, you're not pretty. So as a result, there is more pressure now than ever to conform to the social ideal of thin. Men do not escape the social ideal of thin and a fit body. In our Jonas study, men responded with 10% more frequency than women that they wanted to be thinner. So despite responding more frequently that they wanted to be thinner, women were still at higher risk for developing an eating disorder. Question number 4. No treatments have consistently been shown effective with adults with anorexia nervosa. If you were a psychologist treating a college student with the disorder, what treatment approach would you use and why? So we would use a combined approach beginning with behavioral therapy followed by CBT or family systems therapy, depending on the client's circumstances. This is the approach that was seen to be successful with Joan. Behavioral therapy was used at first in the in-treatment portion of her care to immediately begin consuming a healthy amount of food, monitoring her diet, restricting some of her privileges and making those privileges contingent on compliance with the diet. That was then combined with psychotherapy, and then in her case, CBT continued in the outpatient portion of her care. So Joan's case demonstrated this approach and showed it to be successful. And then Russell et al. In 2019 reviewed 281 cases and stated that behavioral and CBT family systems therapy are the most studied and supported by empirical evidence for successful treatment of anorexia. So this combined behavioral and then either CBT or family systems, depending on the patient's living arrangement, has shown to be a successful way to address anorexia nervosa. And again, as the question suggests, not going to be successful in every case, but if you're looking for a generalized approach that should be effective in most cases, this seems to be the best approach. So just to review the summary of Joan's case, at the time the case study was performed, she was a 38-year-old woman with a good job and stable family life with her second husband, Mitch. She lived with Mitch and her son from her previous marriage, which had ended in divorce. Joan was 5'3" and weighed 125 pounds at the time, which was considered a healthy weight. She struggled with a serious eating disorder between the ages of 29 and 34. So she had about 4 years maintaining a healthy diet at the time of the case study. She was hospitalized for 30 days at the age of 34. And that was a successful treatment that helped her overcome her eating disorder. The beginning of the successful treatment that helped her overcome her eating disorder. At the time of the study, she was no longer preoccupied with dieting and weight control, and her current attitudes and behavior were demonstrated to be healthy. Just a quick review of our group assignments. Lauren Alford was our researcher. Susan Darawala did the writing and cleanup. Carrie Jones was a researcher for us. Byron Rutland, myself, was worked as a facilitator and writer, and Kennedy Thomas was our designer and editor. Thanks for listening. Have a great day.